One of the promises he's working to keep. Another one, speaking of the president-elect, here's a familiar campaign promise.
Premiums are surging, companies are leaving, insurers are fleeing, doctors are quitting. By the way, doctors, they're leaving, they're quitting. I have a friend who's a doctor. He said, I have more accountants than I have nurses. It's so complicated. And deductibles are going through the roof. I'm asking for your vote so we can repeal and replace Obamacare and save health care for every family in North Carolina.
So now he has changed his tone just a little bit on the future of the health care law, hinting at fixes in some areas rather than a full repeal. So what can we expect next year? Dr. Devi is a clinical associate professor at NYU School of Medicine. Thank you so much for joining us on this Thanksgiving.
Well, happy Thanksgiving.
So as we talk about Obamacare, we just heard the president-elect talking there, and he says that doctors are quitting. Is that true?
Well, some doctors may be quitting. I mean, I think for doctors, the main issue is probably related to the electronic medical record and some of the costs. So on the surface, an electronic medical record may not sound like a big deal, but I think patients see it a lot too, where doctors are spending most of their time maybe staring at the computer rather than talking to the patient, or spend a lot of time on the documentation afterwards. All of this stuff tends to affect the patient care, affect sort of the communication between doctors, because those records don't always, facilitate this communication between doctors and the healthcare system.
Yeah,
but more importantly,
I was going to say, with the doctors and the patients, there's also the uncertainty, which makes it hard to plan for the future.
I think that's the biggest issue facing patients, the uncertainty whether you're sick or whether you're healthy, whether you're for the current law or against it. Not knowing what's going to happen in the future can definitely create more anxiety and more stress, right? So there's the uncertainty. There's also a lack of transparency in terms of figuring out which plan to get or what's the best for you, right? Most people need to talk to someone else to try to figure out, well, which plan should I get? And then there's also a fact that you might not know, well, what does your plan cover in the next year, or will your plan still be around? So all of these things can make things harder for patients.
Yeah, but healthy people also impacted. How is that?
Yeah. Well, I think both sick and healthy people are affected by this. Now, healthy people, the issue is that most of the time they will buy plans that have low premiums and high deductibles. But the problem is there are actually two. So first, if they have high deductible plans, then they can get stuck with a lot of the costs for their health care. So even if, let's say, you have some knee pain and you end up getting an MRI, that MRI could cost you about $2,000 and you get stuck with that bill. So first, you might find yourself paying the same medical costs plus a premium, so you might be concerned. And second, in terms of hospitals and healthcare providers, a lot of times they get concerned when costs get passed on to the patients, because they're worried about whether they'll actually get paid in the end. So both those things can cause healthcare providers to pull out of these plans and then leave the patients hanging.
Pay more for better outcomes?
Well, that's also another issue. So on the surface, that sounds great, right? If your patient is healthy and you get rewarded for that, that would be ideal. And a lot of advocates of the current law talk about that we should reward people for keeping their patients healthy. But the problem with that type of incentive is that down the road, it creates another unexpected side effect where people might feel like, let me cherry pick the healthy patients. So if I'm a healthcare provider and I get rewarded for having healthy people, let me find the people who are already healthy. And if I get punished for treating the sick people because they're sick, then let me avoid treating sick people. So that's not the intended consequence here, but that's something unintended that might come up down the road. I already have started to see it myself, even practicing in New York.
Well, people, bottom line, they just want to have more control over what they pay.
I think people in general, Americans and most people want to have control over what they're doing, right? So if you're a healthy person, a non-smoker, working out all the time, you may not want to subsidize somebody who is maybe obese, not working out, smoking, kind of has high-risk habits, right? And it doesn't have to be that extreme. Maybe if you're older, you've had your kids and everything else, you don't necessarily want to subsidize someone who is now paying for maternity care or newborn ICU or other things that can get expensive. So I think in general, not having control over what you're paying for is really difficult. I mean, some people compare healthcare insurance to, well, auto insurance. Well, we all subsidize each other with auto insurance, right? But there's a couple things that are different there. So with auto insurance, you know, everybody has to have a driver's license and follow certain rules. But healthcare, that's not the case.
No, it sure isn't. Dr. Devi, thank you so much for joining us. I have to wrap you up, but I hope you have a great day.
You too. Thank you.